So let's talk about the non-surgical options first, because this is always the first line of treatment. And, you know, diet and exercise. Of course, every doctor says diet and exercise, but sometimes that's not so easy to do if your knee is very arthritic and you can't, you know, move as much as you want to. But certainly diet and exercise can help, particularly when you have milder forms of the arthritis. Sometimes in those cases also physical therapy, if you haven't been using your leg or you've been favoring it for a long time and it's gotten weak on you, sometimes some physical therapy can benefit you. There's medications like all of us know about, Aleve and Advil and Motrin and all those things that you can take over the counter. Those are anti-inflammatory medications, and those can help with arthritic symptoms. If you're not able to tolerate those types of medicines because of stomach problems or kidney problems, then you could take like a Tylenol arthritis, and that's another option in terms of medications. Then you've probably heard about glucosamine and chondroitin sulfate and some of these different things that are advertised in the pharmacies and grocery stores as replacing cartilage or growing new cartilage. Well, it doesn't do any of that, but for some reason, it does help people with arthritis symptoms. And they first discovered this years ago in dogs, actually, where they used to give glucosamine to dogs that had bad hips and things. And so it's been around for a long time. It's a supplement, so it's not a drug. It's not regulated by the FDA. So if a patient's interested in trying it, I just say go to Costco or Sam's Club, get the biggest, cheapest bottle, and try it for 6 weeks or so. And if you're feeling better, then that's great. Keep doing it. If it's not helping you, then there's really no downside. You just stop it. Then you've heard about things like cortisone injections, and some questions that I hear commonly from patients are, you know, are they bad for you? How many can you have? How long will they last? And do they hurt?
That's true. That's what I would want to know.
So that's all the questions that people want to know. So are they bad for you? If you have a joint, if you had a normal joint, let's say you were 30 years old and you had a pretty normal knee, but you injured it, and I gave you a cortisone shot, and then I did it again a month later and a month later, and you know, over time, every time your knee hurt, you would come in for a long duration, then that would be bad because the cortisone can cause some of the normal cartilage to wear down if you do it repeatedly over a long period of time. If, on the other hand, you come in with arthritis already in your knee or other joint, then cortisone is a great option to help reduce the inflammation and pain. And because your goal with arthritis is to be able to function and do the things that you want to do until a point where cortisone and pills and things aren't helping you, then surgery is the option. So the cortisone is not going to cure the problem. The arthritis is not going to go away. Unfortunately, it's going to progress over time no matter what. So if cortisone helps you, and they generally, if it's going to help, it generally will last 2 or 3 months. But again, the worse disease that you have, the less it'll help you. It won't last as long. So that's, you know, that's something that we can't really predict how long it's going to last. But certainly if it was only helping you a short period of time, you wouldn't keep having it over and over again. So, and does it hurt? It's like a sting. It feels not much different than a tetanus shot or a flu shot or anything like that, particularly if you have an orthopedic surgeon give it to you who's very experienced in giving them, and so it's just a 2-second thing. It's very simple. It goes right in. We kind of freeze up the skin beforehand, but you know, it's a very straightforward process for giving the injections.
Can you compare that to hyaluronic acid?
Yep. So here's the next slide on hyaluronic acid. Good question. That was a perfect lead-in. I like planted them back there in the audience. So hyaluronic acid, or hyaluronate, is another type of injection. Generally, it's 3 injections, so 1 a week for 3 weeks. A lot of different companies make it. You've probably heard of it as a Synvisc or a Hyalgan or an Orthovisc or Euflexa, some of the different brands that are out there. Synvisc actually makes one that's a single injection, so they tried to combine them together for one shot. So my experience has been that the 3 injections work the best and last the longest. I've had some patients that wanted the Synvisc one, and we've done that, and I haven't felt like it's lasted them as long as the 3, but those are all options for you. In terms of how long, like I think a great situation, like the ideal would be you get the 3 injections, it starts helping you after the 3rd one, and it lasts you at least 6 to 9 months, sometimes as long as 12 months. And then you can have it done again. And it's not cortisone, it's not a steroid, so there's really no downside structurally to having the injections. It doesn't rebuild cartilage, but it kind of helps to cushion the cartilage. It's a higher, what they call molecular weight, so it's a heavier substance than like a cortisone injection, and so that's what helps to lubricate the joint for you. And so you can keep having that every 6 to 9 months as long as it's helping you. And unfortunately, at some point, it will stop helping, and then you can look at a replacement of some type. If it doesn't last you 6 months, then most insurance companies and Medicare will not approve it any earlier than 6 months. So it needs to kind of help you that long to make it worthwhile. Do they hurt? They feel the same as the cortisone injections. Maybe people feel a little more pressure in the knee when I'm injecting it just because it is a little bit thicker material. Sometimes you'll hear of people calling it a gel injection. It's not really like a gel like you would think of. It's still a fluid that's pretty easy to inject in there, but it just gives you that sense of fullness a little bit more than a cortisone injection.